Hey everybody, it's Dr. Mike here again, and we are continuing on with our series of what can I do with my degree. I have with me here one of my former supervisors. This is Jae Greer. We worked together from approximately 2014 until 2018, I believe, or 2019, something like that. um, but Jay has been both a health coach and she was my clinical supervisor during that time. So we wanted to take a couple minutes to have her talk about her experience in corporate wellness and steps kind of you can take to get to that same kind of position. So Jay, first off, can you kind of tell me a little bit about your background, like what your credentials are in the field?
Sure. I have a bachelor's in kinesiology with emphasis in athletic training, and then I also have a master's in clinical exercise physiology.
Oh, right,
So
awesome.
those are my credentials right there. And I am ACSM certified as well as NSCA certified. Um, with ACSM, it is now, I think it changed to the clinical exercise physiologist since they took away the RCEP.
Yeah. Yes, I think the RCEP and the clinical exercise specialist both merged into the same single source. I know that was kind of a bit of a controversy since the RCEP needed a master's degree, but the original clinical exercise specialist only needed a bachelor's. So I know there was a little bit of pushback on that one, but great. Now, as far as your actual job was concerned, can you tell me a little bit about what it actually was like being both a health coach and then being a clinical specialist?
Sure. As far as health coaching goes, uh, I really loved it, being that it kept me clinical and it kept me on my toes. As a health coach, you definitely had to rely on your degree, working with different individuals, trying to individualize um, their goals. I really relied on my experience working in cardiac rehabs, also being a personal trainer. All of that came into play because you're going to be dealing with both the healthy population, apparently healthy population, as well as the clinical population. So I really enjoyed being a health coach because I had to pull from just about everything that was in the book, everything I learned in a hospital, everything I learned in a clinic. Basically is what health coaching is: listening to people and trying to meet them where they are and help them meet their health goals.
Awesome. And what would kind of a typical day look like for you as a health coach?
Health coach, anywhere between 15 to 20 cases. Could be uh, exercise, weight management. As a health coach, you also have disease management programs. So you're going to be working with someone who just wants to lose, 10 or 20 pounds, or someone who has heart failure or has diabetes who needs to lose weight. You can be working with someone who just had or is about to have bariatric surgery. So it's going to be a diverse population, and you probably heard me say this: that's one of the best things about health coaching is the diverse population, but it's also one of the worst things about health coaching because it's a diverse population.
Absolutely.
So you're doing those cases, you're documenting, you're creating personalized exercise programs, and that's your day. You have to remember to get up and use the restroom or have lunch, but that's your day. You're really talking to people.
Absolutely. Yeah. Now, could you tell us a little bit about what it was like when you were then a clinical specialist?
Sure. As a clinical specialist, in that specific role as a clinical specialist, mainly it was making sure that the health coaches had what they needed. You know, you wanted to make sure if they were missing a resource that you got that resource. You wanted to make sure that they knew about all updates to any of the clinical guidelines. So if an exercise guideline changed for back pain, you wanted to make sure they knew that. If something was updated about weight management, weight loss, whatever it is, you want to make sure your coaches know so that they can make sure that they're applying that and staying within the exercise guidelines from whatever the governing body is. So that was the main thing that I was doing, making sure our manuals were up to date, staying abreast in all of the other chronic conditions, making sure that I knew what was on the way. For example, diabetes, that was going to be a big change with resistance training. So I wanted to make sure I knew that so I could funnel that down, get to the nitty gritty so the coaches could relay that to their members. If there was very, very complex cases, then I would get those. But that was pretty rare because our coaches had that clinical experience. So I didn't have a huge caseload. I maybe carried maybe 4 or 5 people that I had to do myself. But everything else was just making sure I stayed aware of any type of clinical changes.
Great. So it'd be kind of fair to say that when you were a clinical specialist, that was more of a supervisory role, or more of like, I don't necessarily want to say an administrative role, but you took more on more administrative duties there as opposed to doing the kind of frontline work there.
Absolutely. Absolutely. In managed care, the best thing is to have a supervisor or a manager who's actually been on the front lines, because then they absolutely know what's needed. They know the system. They know where the pitfalls are. They know to ask the health coaches on a regular basis, what are you seeing? What's changing? But yeah, it was more training, documentation, updating policies, procedures, than actually touching the members. But it was just as clinical, if not even more so, because you had to funnel down things that, okay, that doesn't apply to this, but it does apply to our nurses, so they probably need to know this. Or, hey, this doesn't apply to the nurses, this applies to the respiratory therapist. So you're just funneling information and trying to stay within everybody's guidelines, but also within everybody's scope of practice, which kind of got tricky.
Oh yeah, absolutely. Now, kind of pivoting a little here on that, I know as well as you do that it takes a certain type of person to be a health coach or to work really with, just a diverse population. What would you say is the kind of personality you need to really have that kind of position?
I definitely say you need to love what you're doing, and always remember it's about the member. So my biggest passion was patient education. It still is patient education. And I just had to know I'm still doing patient education, except I'm doing it in a different manner. So you really have to love helping people. Love helping people reach their goals. You have to love the field, because our field is always changing, and it's a lot of information that you need to stay up to date on. If you're passionate about health, if you're passionate about fitness, if you're passionate about coaching, then this would be the field for you. If you don't like helping people, it's definitely, you're going to bump heads, because you're going to deal with a lot of different people, some good, some bad. It's going to be difficult personalities. But if you have a love for the field, you have a love for helping, even though you're going to have some resistance, then you're going to be okay. But it's not going to be a cakewalk, because you're going to deal with so many different personalities. You just have to know, okay, these are my guidelines, this is my scope, and you're going to have to really relay that in a lot of different ways. Some people are going to want to go straight, hey, just give me the facts. I don't need any fluff. Some people you're going to have to hold hand, give a little fluff, give a little bit more encouragement. So your personality is going to have to match that person you're working with. And you're just going to have to keep it professional, leave everything where it is, don't bring it, home with you. If you had a bad call, you just had a bad call. Okay, move on to the next. This is a totally different person.
Oh yeah.
So you're gonna have a thick skin.
Oh, absolutely. I think anyone that's working with any kind of caseload or diverse patient population, there we go, is going to have those kinds of days challenges. So yeah, it's definitely good to hear all that. Now, with that kind of in mind, why did you actually want to get into corporate wellness to begin with, or what kind of led you to getting into that?
Um, to be perfectly honest, I had never even heard of managed care programs, telephonic health coaching. I was strictly in the hospitals. Um, if I want to be totally honest, the way I got into the medical field, I was in the military, and I was a combat medic. So I knew I loved the medical field, and from that, kind of opened up to, okay, I think I like the clinical side a little bit. I was working in a hospital, and they had a low census because it was in Arizona. So snowbirds go away
Yeah.
in the summer.
Yep.
So we had a low census, and I needed to find another job just because they were cutting hours. And I saw a position for exercise physiologist, health coach. And I applied to it, not really knowing what I was getting into. And that led me to managed care, because that's what it was. And I ended up really liking it, and I just stuck with it. It was a lot more opportunities working in the managed care sector than it was, staying in the hospitals doing inpatient or outpatient rehabs, cardiac rehabs, or working in the cath lab.
I got you there. Now, where do you kind of see the corporate wellness field going here in the future? Or how do you see that this type of kind of employment like evolving now, as we see almost our entire healthcare landscape changing now with definitely with COVID and everything else going on?
Um, I definitely see a big boom coming for telephonic or some type of online health coaching programs and platforms where they're going to have to be more detailed. It's not going to cut it just a 15 or 10-minute call. But I definitely see with COVID-19, everyone is seeing how important it is to have some type of online platform uh, to still meet the needs of their members or their patients. So it kind of reminds me of the physical therapy boom. At first people didn't think it was possible to do physical therapy online or through a video. And now, that's becoming a norm, a staple. Hey, if you can't make it, we have this.
Yep.
So I think it's going to become more of a staple, and we're going to see a lot more places having online everything. We have apps for everything, and you're going to see the insurances. You're going to see just about every healthcare entity have some type of application where they can do some type of online, what is it called, telehealth. It's
Mhm.
going to be appointments, it's going to be exercise, it's going to be talk to your doctor. It's going to be a staple now. I don't see that going away.
Yeah, and I mean, even if you take out the face to face or physical component of it, I don't see a way that you can get rid of the person. So I think there's always going to be a need for having that you know exercise specialist or that health coach that specializes in some sort of either lifestyle or disease management care to at least be on the other end of the phone. Uh, but yeah, that's definitely some great insight there. And then kind of want to finish up here with getting kind of just your personal opinion. But I know we kind of talked about before, things you'd like to know about when you were in school. What do you think, or what kind of advice could you give our incoming freshmen here about, what they can, if they wanted to get into corporate wellness or even just getting into, the health coaching field at all? What kind of advice would you give them?
I would definitely stress the importance of either, being licensed or being certified. I can't stress the importance of that. It's good to have a certification, but I will always encourage, I know times are changing, but those gold standard certifications, it's going to be a must. Um, as of right now, ACSM, NSCA, strength and conditioning, those are all, I don't foresee them going away, but it's going to be important. And I wish someone would have told me to get those while I was actually in school. Maybe start off with just a certified personal trainer. Get aware, get used to how you're going to be tested. But as soon as you get that bachelor's degree, yeah, go ahead, sit for the test, actually have that while everything is fresh, because that's what the employers want. They may give you time, some, but if you're coming in, they're like, okay, this person is ready, let's hit the ground and start running with it. But if I know degree programs vary, with mine, it was a kinesiology degree and you had a different track. You could do physical education, athletic training, or just straight kinesiology. And doing athletic training, it opened my eyes to exercise rehab a little bit more. So I would always encourage, take some classes, kind of see what you like. This is the time. Me, I love kinesiology, but I felt more connected to exercise physiology just from my intro class. I knew that, hey, I really like this. I really want to delve more into it, and that's exactly what I did. So with the undergrad, as an undergrad, I wish someone would have told me, hey, go get certified right away and then start working in the field. It probably wouldn't have taken me as much time to know, exactly what cardiac rehab was. I had never heard of it until I actually went for my master's, which is kind of crazy to me now.
I'm with you there. It wasn't until I was in my master's program that I even heard of cardiac rehab. So yeah, great advice, definitely there. Well, that's everything I have for you here. So again, Jay, thank you so much for your time. I do appreciate you sitting down with us and letting us all know a little bit about you and your insight into corporate wellness. And hopefully we'll be talking to you again here sometime soon.
Absolutely, and thank you so much for having me.
All right, you take care.
Thank you. You too, Mike.